video, we're going to look at how to draw blood from a patient using venipuncture with a butterfly needle. Now, we try to draw blood from a working venous access line if a patient has one, but if not, you have to use the venipuncture to do it. So in this case, you could use a butterfly and a Vacutainer, or you could use a butterfly and a syringe, but we're going to show you the Vacutainer method. So you want to start by identifying a good vein, just like you would if you were starting an IV. The difference in this case is you can kind of go whatever vein you want because we're not leaving a catheter in place. So place your tourniquet 6 to 8 inches above where you want to look and palpate till you feel a good vein. Remember to aim for what you can feel, not just what you can see. Then release the tourniquet while you get your supplies ready. So you're going to need a butterfly needle. Usually these come in 23 or 25 gauge. And then you'll need to attach the Vacutainer to the end of the tubing. You're also going to need alcohol preps or an antiseptic scrub if you're drawing blood cultures, a tourniquet, gauze, and some tape. And then, of course, whatever blood tubes you're drawing. When you're ready, replace your tourniquet about 6 to 8 inches above where you're going to be sticking. Palpate again to make sure the vein is still there, and then you can clean your site. Now, if it's a regular blood draw, you can just use alcohol pads in a circular fashion from the inside out. But if you're drawing blood cultures, you must use antiseptic scrub, and you must scrub for a full minute, back and forth, up and down, round and round, get rid of as many bacteria as possible. Either way, don't touch it once you clean it, and make sure you let it dry. Now, take the cap off of your butterfly. You're going to stabilize the vein below the insertion site. Hold your needle bevel up at about 15-degree angle. Insert the needle till you feel a little bit of a pop. Now, this is something that you're going to learn that feeling with more experience. And you may or may not see a flash of blood. So once you think you're in, keep one hand on the needle. Use your other hand to insert the first tube into the Vacutainer, and the vacuum action will pull the blood out for you. Then gently pull the tube out and make sure that you invert it 4 or 5 times. And repeat that with as many tubes as you need. So the goal with inverting that tube is to make sure the blood is nice and mixed and doesn't clot. So once you have what you need, you can release your tourniquet, then put a piece of gauze over the site and quickly pull out the needle while applying pressure to the site. Make sure that you also activate the safety device on your needle as well. So hold pressure till the bleeding stops, and then you can tape a piece of gauze over that site. Always keep in mind if your patient's on blood thinners, sometimes they'll come back to you with blood dripping down their arm. So just hold pressure longer if you need to. All right, put your sharps in the sharps container, throw your trash away, label those tubes appropriately, and send them off to the lab. So that's it. Easy as that. So just like starting an IV, drawing blood this way takes practice, and you'll get better and better at it the more that you do it. We love you guys. We know you can do this. So go out and be your best selves today. And as always, happy nursing.